Governor Lamont challenged the commissioners behind me and I to develop transformative proposals that will help families recover from the impact of COVID-19 and lead to positive long-term improvements for our state. As the governor referenced, when Vice President Harris was in Connecticut to talk about child poverty and child care, the governor, Commissioner Durantes, and I shared information with her about the very high rate of poverty among families with young children, and that the highest number of referrals to DCF are from families with young children, and this is often tied to poverty. At the same time, Commissioner Gifford urged us commissioners to focus on reducing health disparities before they start as we considered strategies. And Commissioner Russell Tucker knows that high-quality early experiences help reduce educational inequities before they start, and also help children arrive socially, emotionally, and educationally ready to learn. Early investments have a very high rate of return. Supporting children and families from the start makes for a more equitable Connecticut and improves the quality of life for all of us. Two areas in the plan that address equity and the impact of the pandemic are childcare and home visiting. Governor Lamont has spoken so much and so well about childcare and how important it is, and he's talked a lot about the investments we're making. $220 million to make early childhood education more affordable for families, to improve the quality for all children, and help sustain our childcare infrastructure. He's also proposed funds that will make free summer enrichment learning for children who missed out on preschool this year because of COVID. The childcare industry and families have suffered during COVID. These efforts will help. And then a new initiative that will be really cross-agency. Will be working closely with DSS, DCF, DPH, and the Office of Early Childhood. The administration has developed a plan to expand home visiting to all Connecticut families. Starting in the regions hardest hit by COVID, families will receive 1 to 3 home visits in a baby's first 12 weeks of life. Home visitors will check on the mother's health and the baby's health and connect families to resources, and as needed, to community health workers that Commissioner Gifford's going to talk about. Connecticut has significant inequities when it comes to maternal health, birth outcomes, and perinatal health, and home visiting programs have been shown to prevent later interventions. For example, families that participate in home visiting have a 44% lower rate of referral to child welfare agencies, and emergency room visits are cut in half. These early investments will have an impact now for recovery, but will pay off in the long run for Connecticut's families and children, and indeed for Connecticut's budget. Connecticut will be stronger, safer, and healthier.